Okay, well, welcome everyone. This is Dr. David Dobrikowski. I am an associate professor here at Rutgers Business School in the Department of Supply Chain Management, and I also serve as the program director for our new Masters of Science in Healthcare Services Management. I'm delighted to speak with you all this morning. Look forward to chatting with you about our new Masters of Science program and, of course, answering any questions that you have. So why don't we go ahead and get started. Our agenda will be as follows. I'll start out by talking about why especially Master's Program in Healthcare Services Management might be of interest to you, why it's important from an industry perspective today. Then I'll move into a brief discussion of how the Rutgers Business School, the RBS program, is unique, some of its unique attributes as well as kind of delivery methods. And then we'll finish things up with a brief discussion of next steps. If you're so inclined to move forward with an application, we'll talk about how you can get started with that. And of course, if you have any questions, both throughout this webinar, feel free to type them in the chat, or if you'd like to save them for the end, that's fine as well. But I'm a pretty flexible individual when it comes to these types of presentations, so feel free to chime in. We want to make this as valuable as possible for you all. Okay, so let's go ahead and get started. Well, it's probably no secret to any of us here in the United States. We can't listen to a news blog or read a news blog or listen to a podcast without being made aware that healthcare costs have been increasing substantially for, frankly, 25 or more years. At the same time, though, while this is placing great pressure on employers in the industry and also, say, then providers in the industry, there's also pressure mounting now to improve quality. We think of quality care in the United States, of course, as being the gold standard, and that's very true, but that doesn't mean that individual residents don't have some reservation or concern about having access to quality care. This Kogan study in the center top box actually identified that roughly 2/3 of individuals responding to a survey indicated that they were concerned about having access to high-quality health care in the United States. So what we're seeing here is that healthcare providers now are increasing the pressure that they feel from the perspective of improving costs and at the same time trying to improve quality of care. This is growing in importance, of course, because not only is it just clearly the right thing to do, of course, all organizations want to improve in terms of cost and quality, but at the same time in the healthcare space, the reimbursement methodology is changing substantially. We're moving from what you might think of as a fee-for-service or volume-based type of orientation, in other words, a reimbursement system where providers in the past have many times been paid based on the volume of services that they provide, and that's a generalization, it's a simplification, of course. There are many different reimbursement methodologies, but the general theme has been a very revenue-oriented type of model. We're now shifting to a more value-oriented type of model. So now we're moving towards, you may have read or heard about programs like accountable care organizations, ACOs, patient-centered medical homes, and other programs like value-based purchasing that are linking reimbursements to hospitals and healthcare provider organizations to outcomes such as readmission rates if you're an inpatient hospital facility, outcomes such as patient satisfaction, or what in the industry we think of as HCAHPS scores, which is a survey provided by the federal government Center for Medicare and Medicaid Services, and nosocomial infections, which would be like hospital-acquired infections, and so forth and so on. So now all of a sudden these outcomes are being linked to hospitals' reimbursement methodologies. And it's a major challenge, of course, for hospitals and healthcare providers, because it's not just, what's so interesting about this is it's not just a matter of improving on these measures, but it's a matter of outpacing the improvement of your competitors. In other words, if the competing hospitals that you have in your region are all improving at the same pace, that essentially means that you maintain a static type of position in terms of your reimbursement. So you're actually trying not just to improve, but to improve at a faster pace than your competing hospitals. So it leads to a much more competitive environment. If you look at the left bottom box now, a new competitive environment that hospitals, haven't frankly faced in the past, in terms of this type and level of competition. At the same time, we're not just feeling competition locally here, but really, for the first time, we're seeing serious global competition enter the healthcare space. So prior to my PhD, I worked in the healthcare industry for 13 years, about equally balanced on the provider side. I used to serve as regional CEO for a diagnostic imaging corporation where I ran independent diagnostic testing facilities, MRI, CT, plain film X-ray, ultrasound, and also in the acute care space with firms like Catholic Healthcare Partners out of Cincinnati, Ohio. And then I spent the balance of that 13 years, about 6 years, in the insurance services division, working for organizations like United Healthcare. And I could tell you that in 2002, 2003, when I was running the MRI centers, what globalization meant to me was that a transcription company from India would come and try to quote me on 1 cent per line for my transcription services, as opposed to the 6 or 5.5 cents I was paying per line here in the United States. But I didn't feel global competition. I started to see globalization, but I certainly didn't feel global competition. But today now, all of a sudden, organizations that are well known, like the Cleveland Clinic, have opened overseas. Mayo Clinic is doing the same. I recently spent a few weeks in Singapore teaching in our international EMBA program, and I can tell you that the students there, many of which are expats from the United States, were telling me stories about their family members coming to Singapore and even Thailand to have medical procedures done, and that were elective, of course, and rolling them into family vacations. It's a remarkable phenomenon that's taking place now. The Merrick study, 2009, that's referenced in that bottom left box, actually states that healthcare can be delivered abroad for pennies on the dollar, about 8 cents on the U.S. dollar. So while it's still kind of a new and growing phenomenon, for the first time we're starting to feel pressures as healthcare providers, not only for cost, quality, and these changing reimbursement methodologies towards patient outcomes, but also now much more competitive environments and also global competition. So if you think about those 4 factors, a focus on cost, a focus on improvements in quality, a focus on being more patient or customer-centered, and at the same time realizing increased competition, these are pressures that are not dissimilar to those pressures that were felt by the domestic manufacturing organizations, specifically the automobile manufacturers, say in the late 1980s and into the 1990s, when the discipline of operations and supply chain management really started to gain some traction, gain some momentum. Operations and supply chain management is a discipline that's all about trying to integrate, in a more effective way, the flows of information, material, and financial exchanges amongst organizations. So if we can better integrate the way we work together, essentially, the thinking is that we can produce better outcomes, and we can avoid some of these trade-offs. In other words, we can do things like improve both cost and quality if we work more effectively together. So you start to see that there's a lot of interest now on the perspective of healthcare providers in implementing a lot of these ideas from the operations management and supply chain management field. Ideas like Lean and Six Sigma, ideas like advanced information technologies, or more specifically in healthcare, electronic health records and regional health information exchanges. Ideas like taking a more systematic, quantitative approach to managing materials and so forth within the hospital and healthcare provider organizational context. The problem is that hospitals are not manufacturing Toyota Camrys. I can't tell you how many times I give talks to physicians or hospital executives. I've been very fortunate in the last 3 years. I've been invited to the American College of Healthcare Executives Leadership Congress in Chicago in March, and it's the largest gathering of hospital CEOs in the United States. And for the last 3 years, I start out my talk with this question. I said, now help me complete this sentence. It's 3 words. We are, and the entire audience chimes in and says, different. And I agree with them completely. You're absolutely right as a healthcare provider, right? We can't just take these ideas from manufacturing and implement them directly in a hospital or in a healthcare provider organization. Well, why is that? That's because the context is different, right? We might be feeling the same pressures for cost, quality, and customer satisfaction and competition, but what we do is fundamentally different. So what are some of the characteristics that are unique? Well, one, for example, if you look at that bottom center box, deals with the fact that physicians are a very important, a key part of healthcare delivery, of course. And if I'm operating a hospital, if I'm the CEO of a hospital or the COO of a hospital, or if I'm responsible for clinical operations in any way, CNO perhaps, right, I know that the physicians that I work with to a large extent are not employed by my facility, right? In other words, if you were to look across the United States, and this might surprise you, only somewhere in the neighborhood of 25 to 30% of the referring physicians in the United States are employees of the hospital. So roughly 70 or so percent are remaining independent today. And that varies by specialty, of course. You can find some specialties like cardiology where the percentage is much higher. But generally speaking, across the board, this is the environment we're dealing with. Well, that's a major challenge if you think about it as a hospital operator, because now all of a sudden if I'm trying to implement change and I'm relying on physicians to refer patients into my facility, so they provide me with the critical opportunity to service patients. No one drives down the road, right, and says, yeah, today's a good day for a hip replacement. I think I'll just stop in at my local hospital and have one. In other words, I need to have, as a hospital leader, I need to have physicians refer patients to me. And then also once physicians make those referrals, and patients are admitted into my facility, now I have to rely on those physicians to come and actually treat patients in my hospital. And when doing so, many of the decisions that these physicians make related to the type of material that's used, related to the types of medications that are prescribed, related to the way that they work with other physicians in the hospital, directly influences those outcomes that we spoke of earlier, like patient satisfaction, of course, like, say, the cost of delivering care, and so forth and so on. So we have studies, in the box there in the center bottom that indicate that up to 80% of the hospital cost and quality outcomes are driven by physicians. But yet, we may or may not have any direct control or even alignment, frankly, with these physicians. It's also possible that physicians may be operating under a different reimbursement methodology entirely than my hospital. So this is just one complicating factor that makes it more difficult to simply take all of what we've learned in, say, manufacturing from an operations management perspective and apply it directly in healthcare. Right? And there are many other of these challenges that we unpack in our master's program to understand how to contextualize what we know about operations and supply chain to implement these best practices more effectively in a healthcare provider organization. So kind of summing up that bottom right slide now, bottom right box I should say, healthcare providers are under extreme pressure to improve business performance, but at the same time they're operating in a very unique operational context. As a result, what we do know, right, as an industry is that we need healthcare managers and healthcare leaders working in healthcare provider organizations with an improved and unique and well-developed skill set aimed at improving those outcomes that are now linked to reimbursement, like HCAHPS scores, readmission rates, nosocomial infections, and so forth and so on. So it seems very timely to engage in a program that prepares managers and leaders to better operate the facilities within which we work. And industry statistics would seem to support that. Moving on to the next slide now. If we look at what has happened in terms of healthcare employment, over the last 10 or so years, you look at the bottom left, there are two very interesting lines there, I believe. The blue line that's kind of a curved line, and then the red line is more of a straight, positive, sloped line, right? What this graph essentially tells us is that, my mom was right when she said, David, you should think about healthcare as a career because it's recession-proof, right? If you look at the blue line tracks general or total non-farming employment as a statistic provided by the U.S. Bureau of Labor Statistics from 2004 to 2014. And what do you see? Well, of course, where you see the Great Recession there in 08, 09, and into 10, we saw a major dip in employment, right? And many of us lived through this. The red line represents, guess what? Healthcare employment, right? Nice, strong, steady, and stable. So that's a backward-looking view, right? But in terms of a forward-looking view, if, again, we look to the U.S. Bureau of Labor and Statistics, it appears that this is going to continue to be a very attractive place for managers and healthcare leaders to live, right? If we look at that top bar in the bottom right of the slide, Employment for medical and health services managers is expected to grow between now and 2022 at a rate of 23%. Compares, very favorably to total occupations in the red bar there at 11%, and it triples all management occupations, growing at only 7%. So healthcare employment has been stable, and it appears to be growing is kind of the message there. Well, that's nice, but, can I make any money doing this, right? Well, that's a good question. If we look at how that employment is distributed, that's what I'm showing you here in the table at the top of the slide here. The majority, of course, is in hospitals and other healthcare provider organizations on an outpatient basis, like offices of physicians, nursing homes, long-term care facilities, and so forth and so on, right? These are those organizations that I spoke of earlier that are feeling those pressures for cost, quality, and improvements in patient satisfaction, and so forth and so on. And you can make a pretty decent living doing this. So we pulled some data from the state of New Jersey as well as national. And if you look at in the state of New Jersey, hospital COOs are reported to be earning about $277,000. Hospital VPs of process improvement, this would be like your Lean and Six Sigma systems thinking types of people, are at $114K. General medical and health services managers, again, this is a national statistic now provided by the U.S. Department of Labor, are just over 106. A health systems management engineer, which would be an excellent kind of almost entry level, maybe just a pinch above an entry level type of position for a process improvement person, are coming in at six figures, over 106,000. And then we see on the outpatient side, practice managers at 84, and so forth and so on. So it seems that healthcare is in need of individuals who understand how to operate these facilities effectively and improve outcomes, and it seems as though that employment is stable and growing and lucrative. So what are we doing here at Rutgers Business School to respond to the needs of the market, and what's unique about what we're doing here? Well, if you look at this slide, slide 6, it's a macro level view provided by Gartner, which is a big consulting organization, of the macro healthcare delivery supply chain. And if you look off to the top right, what you essentially see there, what I've marked as the traditional supply chain, where we have wholesalers, distributors, manufacturers, those individuals and organizations, I should say, that are involved in developing what we think of as the inputs in healthcare delivery. So all the devices that are used and materials that are used, right? And if you look at this space, Rutgers Business School has done an excellent job of establishing a strong foothold, right? In only 8 years, we were consistently ranked, in the top 10 or 15 by a variety of organizations. This happens to be my department, so I can speak from some experience. For the last 8 years, we've had a 100% placement rate for our MBA program in the supply chain space. And what we've done is, and because of course we have fantastic students, that's the number one factor that leads to those kind of results. But as a means of supporting them, we've done some things like provided internships, like provided coursework around industry client projects that provide real-world experience. Those types of ideas and best practices that we also incorporate into our healthcare services management program with an aim to achieve similar results. If you look then at the center bottom, this is really kind of the more product-oriented area of the macro level healthcare delivery supply chain. This is kind of the pharma area, right? So organizations like J&J and others kind of operate in this space. This is a space where we've also done very, very well. We have consistently a top 10, sometimes a top 5 MBA program in pharmaceutical management. So what we'd like to do is we'd like to build on what we've done in the traditional supply chain space, build on what we've done in the pharma area, and start to move further downstream, if you will, to use supply chain terminology, right, into the provider space. And that's what you see at the top left of the slide. Integrated delivery systems, or IDNs, integrated delivery networks, provider offices, right, pharmacies, outpatient clinics, ambulatory care centers, group purchasing organizations, right. This is where, frankly, up to 40% of the total healthcare spend is in the industry, right? It's also where there are some huge opportunities for improvements, but it's also the area that's most unique and most dissimilar to manufacturing or to that traditional supply chain space. So what we're doing here with the program is we're building on what we've kind of established in the traditional supply chain and the pharma supply chain, and we're adapting a lot of that coursework to make it very relevant for healthcare providers to improve operations and improve patient outcomes. So let's move on. what's our overarching objective or our mission? Well, I'm going to tell you, frankly, I'm a very transparent fella. This is not a policy program. This is a program that's designed to develop skills in individuals that want to go on and lead clinical operations and business operations in healthcare provider organizations like hospitals, long-term care facilities, outpatient clinics, and so forth and so on. This is a program that is intended to accelerate the growth of individuals that want to move into management and leadership positions in hospitals and related healthcare provider organizations. And the way that we do that is by preparing individuals with the knowledge, skills, and experience necessary to improve the performance of healthcare provider organizations. When I talk to hospital CEOs, they're not, it's not keeping them up at night wondering about, this next big legislative change or a new certificate of need law, change. What keeps them up at night is, am I going to be able to improve my HCAHPS scores? So am I going to be able to achieve the next phase of meaningful use in my EHR so that I can maximize my reimbursement? These are the issues that are jugular for healthcare organizations, and these are the types of aims that every course in the program attempt to address. So we really have two markets. We have recent graduates from, say, areas like public health and some of the sciences who naturally, through the course of their studies have, found that, they are more interested in a healthcare administration or healthcare leadership type of career. Some medical students as well. And these individuals then can transition into a program like ours, take full advantage of the industry client projects and so forth and so on to launch a healthcare management type of career, or even consulting career perhaps. The larger market, frankly, are the middle career executives. Those folks that look down at their badge 8 or 10 years into their career, and all of a sudden it reads manager. And maybe they're a respiratory therapist, maybe they're a nurse, maybe they're a radiology tech, and very, very bright, incredibly intelligent people with strong academic preparation in sciences or in medicine, but haven't been exposed to business types of skills, like trying to manage and lead people, like trying to understand how to effectively schedule staff and patients, like understanding how to go about thinking about and implementing health IT, all of which are very important skills to develop, of course, if we want to improve the outcomes that I discussed earlier. So the way that we prepare these folks, the way that we achieve this mission, is by creating a program where 50% of the curriculum is aimed at developing operational skills, skills like analytics. Population health, of course, is a major emphasis right now in healthcare because our reimbursement systems, of course, are changing to incentivize improvements in the way that we manage the health of the population that we serve. In order to do that, it's important that we have strong analytical capabilities, right? It's important that we understand how to aggregate data, how to analyze it effectively to improve decision making. About 6 or 8 months ago, remember, I'm a supply chain professor. About 6 or 8 months ago, I got an email from the vice president of HR from a 10-hospital health system that asked me for resumes looking for someone who could be the manager of HR analytics. And what I said to her is, I said, well, thank you very much for your email, and I called her, and we were talking, and I said, thanks so much, I appreciate you thinking of me, but I think you got the wrong guy. I'm a supply chain professor. And she said, well, David, no, what I need is someone that understands analytics. She said, she called them quant jocks. She said, you have all the quant jocks. I can teach them what they need to know about HR. What I need is somebody that can help me to understand how to analyze data effectively to improve decision making. And that's just one example, right? We also have coursework in health services, design, and management, so dealing with issues like physician employment, right? If I'm employing my physicians or some portion of my physicians, does it change the way that I collaborate with them in terms of improving the way that my hospital or healthcare provider organization operates? That happens to be my research specialty and happens to be something I'm very passionate about, right? And I can tell you that there are major differences, right, in terms of maximizing the value that we can extract from, employing our physicians. Issues like how do we go about designing our health system now? The traditional model is what we call a hub and spoke type of system, where we have community hospitals that serve as feeders into a large tertiary care center, right? And this has kind of been the system for many years in the United States. But is that really the most effective? Or, does it make sense to take a more specialty, or what we call a focused factory type of approach, kind of like a Cancer Treatment Centers of America, specialty hospital type of approach? So we look at these different organizational models and think about the right context that is necessary to implement them. Operations analysis, of course, Lean and Six Sigma, Health IT are all key aspects of improving the performance of our hospital or healthcare provider organization, and they're important courses that are provided in the curriculum. So we kind of follow this formula at the top of the next slide, slide 8, where we say, leading teams, leading interprofessionals in healthcare is very, very difficult, and I'll talk about why in just a minute. But it's incredibly important, right? We can't lead change, we can't improve performance if we don't have effective leadership skills. So we have coursework focused in leadership, of course we have some coursework focused in analytics, and we have coursework oriented towards improving operations. And we believe that by taking that tripartite focus, if you will, that organizations and individuals, of course, within organizations can create a new competitive advantage for healthcare. So we're really aiming to achieve 4 outcomes when you complete the program. And the first is that we spend a lot of time fleshing out and understanding the changes that are taking place from a reimbursement perspective. And that includes certainly some legislative changes, but it also includes what's happening, in terms of the private insurers and the types of collaborations and risk-sharing models that are taking place, in the industry. And once we understand how these reimbursement shifts are happening, then we can think about, well, what does that mean for our organization? How do we organize our resources? How do we implement change to respond effectively to those shifts? Of course, health IT, critically important, but also a major thorn in the side of hospital leaders. It's very uncommon. I have yet to hear a hospital leader tell me that they were completely satisfied with their HIT implementation, right? There's literature and practice, magazines and so forth are replete with examples of challenges in terms of health IT, right? So here we have coursework that really focuses on, one, how do I select the right vendor and how do I select the right tools, but more importantly, how do I go about implementing HIT effectively? Population health we talked about a little bit. It's a major emphasis, of course, in healthcare today, and developing the analytical skills necessary to make good decisions and manage the population that you serve more effectively, very, very important. And then number 4, of course, leading interprofessional teams of physicians, nurses, and other healthcare providers and clinicians. When healthcare professionals are trained, if you think about this, they're trained in very narrow and deep disciplines, right? It doesn't really matter if you're an oncologist or if you're a cardiologist, right, if you're an orthopedist, and frankly, even at any level. If you're a physician, if you happen to do nursing work, or if you do technical type of work, we're trained in very narrow and deep silos. And that's good, right, because I wouldn't want my father who has a heart condition to be trained by an oncologist, or to be treated, by an oncologist, right? I want to find the cardiologist or the cardiothoracic surgeon in that case that has the most expertise possible in that area. And that's great. But the problem is now, in order to improve the performance of our healthcare provider organizations, it requires that we work together collaboratively. It requires that we work together well as a team. And when we try to go about leading people, period, it's a challenge. But when we, wrap this around the context of healthcare, where we're trained in these narrow and deep silos, we're trained to kind of work more or less, individually and independently. We have this implicit hierarchy that exists in, many healthcare provider settings and so forth. We have these complex reimbursement systems that may incentivize the different team members differently. It makes it a real challenge. So we have we have coursework in the program that helps to develop strong leadership skills from an interprofessional perspective as well. Very important. Okay, so what are the courses? Well, slide 9 reveals just a sample matriculation. This is not a lockstep program. It is not a cohort program, so you're not required to complete the courses in this specific sequence, but a number of students had asked me to, kind of chart out a map, so I did that. And this is essentially what one potential pathway may look like, right? We have essentially, if you will, off to the bottom right, the core of the program, again, is all about operations, right? So you'll see 50% of the coursework roughly deals with operations. So that would be courses like Healthcare Services Management, which I discussed earlier in the first semester, data analytics and decision making, right? Healthcare operations analysis, which I have positioned here in the second semester. Health innovation and tech management. Lean Six Sigma in the third semester, right? Healthcare seminar. This is a fantastic course. So one way that we've ensured the relevance of the program, because remember, the way we teach this program today is going to be different than the way it's taught 6 months from now and the way that it's taught a year or a year and a half from now, because the healthcare industry is changing so rapidly. And one of the ways that we built in a systematic sensitivity to that change is by creating this healthcare seminar course. So this is a course where the professor meets with the students at the beginning of the semester. He or she comes, of course, with ideas about relevant topics, but we want to have that first meeting so that we can build out a relevant agenda for the course. Students provide input into some key topics, and then the professor secures, say, 6 or 8 industry-leading experts in each of those areas. It might be wearable technologies, it might be healthcare venture capital, it might be, an expansion on, reimbursement methodologies. It could be dealing with physician burnout. Whatever the, the issue of the day happens to be, would be covered in this particular course. And again, it's all as it relates then to operations and supply chain management. In the final semester, again, it doesn't have to be the final semester, but it's positioned as such in this illustration, we have this industry client project. The industry client project, again, will be done in collaboration with a healthcare provider organization. It might be an ambulatory care center, it might be a specialty hospital, it might be an acute care hospital. But what we do here is we partner with industry to take our students, which we group into groups of, say, 4 or 5, and we work very closely on a real-world problem, right, that the client has. So this typically looks like the following. You meet at the beginning of the semester. There's a physical face-to-face meeting with the client, and this is mentored by a faculty member, of course. And then every week there's a weekly conference call with that client to provide updates and to have questions answered and so forth and so on. There's a mid-semester meeting, typically, a presentation where the client can provide more feedback about the scope and direction of the project. And then finally, this continues on throughout the semester, and at the end, a final report is provided to the client. We found that this has been very, very effective, very, very successful in helping to place our master students in the supply chain space, and as a result, we've implemented it here. Best case, students get placed. Best case, students change employers or start with new employers as a result of this project. Worst case, students go with a fantastic story to tell in an interview, with a prospective employer. So those are some of the operations and supply chain courses, and of course, all of which are contextualized to healthcare. We wrap around that a general business acumen layer. So, it's insufficient to only know about the topics I've discussed if you would like to grow into hospital leadership, right? You need to know something about healthcare marketing. You need to know something about healthcare finance and accounting. So you see this kind of woven through the program. We start, with a healthcare systems and managed markets course, which is essentially an industry structure course where we talk about how the healthcare system is structured, how it works and doesn't work, where there are efficiencies and inefficiencies and so forth and so on, and kind of a strong background of the industry. There's also accounting for managers, again, contextualized to healthcare, right? There's the management skills course, again, contextualized to the healthcare context to develop those leadership skills. This is part of that general business acumen layer that we're talking about, right? We have healthcare marketing, of course, finance, like I mentioned, and then this final course, valuation of new business ventures, is essentially a business planning course. It's essential, right, that you leave the program understanding how to construct and frankly defend and present a business plan. In this age of consolidation, mergers and acquisitions, it's very likely that if you're leading a department, you'll be asked to create some sort of justification or a business plan, right? So very, very important. All of the coursework then, the reason we have this red layer off to the bottom right in the circle, is that all of the courses, all 30 to 36 credit hours, are contextualized into the healthcare context. This is very relevant as we move to the next slide here, which speaks to how the program is unique. So I mentioned on the previous slide that the program is 30 to 36 credit hours, and you may be wondering, well, wait a second, how can it be 30 to 36 credit hours? What in the world does that mean? That's a great question. Again, remember, we have individuals in the program who have a wide variety of experiences, right? Some are transitioning, frankly, from other industries into healthcare. Some are 25-year healthcare veterans. Others are, recent undergrads that maybe have worked for 2 years or so and decided that they'd like to, move into the healthcare space. So we need to provide what we feel is a comprehensive program for all these individuals. But if you are one of those folks that comes to us with, 8 or 10 years of healthcare management experience, let's say, for example, you are a healthcare marketeer, you're working in the marketing space, you probably don't need to take the healthcare marketing course, right? Let's say that you're a financial analyst or you've grown to be the director of finance of a hospital, you probably don't need to take the healthcare finance course, right? So we've created a situation where you can waive up to 6 credit hours to get the program down to 30 credit hours, which is, of course, advantageous in that you can finish it much more rapidly. The first bullet on this slide speaks to its focus, right? One thing that makes the program very, very unique is that it is not an MHA. It is not an MBA with a healthcare specialization. It's not an MPH. In other words, if you look at say, the MHAs or the MPH degrees, these tend to be 48 or more, in some cases 60 credit hour programs, so roughly twice as many credit hours, and as a result, twice the cost, of course. And they tend to be very, very comprehensive, which is wonderful. They include courses like epidemiology and research methods and grant writing, all which are very interesting courses. I did a grad certificate in epidemiology. I thought it was very interesting. But I have to tell you, it didn't help me a bit in running the MRI center. It didn't help me a bit moving into administration of a hospital, right? And it doesn't mean it's not valuable. It is, but it's non-essential. It's ancillary to what I'm doing in terms of trying to improve HCAHPS scores and readmission rates and so forth. So as a result, in responding to the marketplace, what we were told by prospective students is that they want a streamlined program, something they can finish quickly and focuses on very relevant skills that will help to improve the performance of healthcare provider organizations. And that's why we've taken what many programs offer in 48 or more credit hours, and we've pared it down to somewhere between 30 and 36 for you. It's delivered in what we call, one more point. What makes the program unique from an MBA is a wonderful degree, of course, but an MBA produces what we call business generalists. So you learn a little bit about finance, you learn a little bit about accounting, you learn a little bit about operations or supply chain, you learn a little bit about IT, and that's all great. But then you're essentially left to contextualize that to your operational context. So like when I did my MBA, I was running the MRI centers at the time. I would take what I was learning and I would apply it certainly, and it was very useful, but I had to think about how do I contextualize this to the fact that I'm dealing with the radiology group, for example, that I have very little influence or control over, right? How do I contextualize this to the fact that I'm not paid in the same way that a manufacturer is paid? I'm paid on more of a global type of basis and so forth and so on. This program does all that contextualization for you in that it provides 30 credit hours of healthcare business operations content. So it's very different, very focused in that way. To make it convenient, because the majority of our audience, of course, are working professionals, we've formatted the program as a hybrid. And what that means is that roughly 50% of the content is delivered online. Roughly 50% of the content is delivered online. What that means to us at Rutgers Business School is not just posting slides and saying, best wishes, we'll look forward to an email from you. What that means to us is that we video record lectures and we create online engagement exercises, and roughly every other week, as opposed to coming to our beautiful campuses in New Brunswick that you see at the bottom there, you have the flexibility to complete the study, to listen to and watch the video lectures and complete whatever assignments are necessary, at your leisure. If you're a working healthcare manager or a physician, and the best time to do it is Thursday morning at 2 a.m., well, you can do it Thursday morning at 2 a.m. Right? So as opposed to coming to campus every week, you're coming to campus roughly every other week. So in a 14-week semester, that means 6 or 7 meetings. Earlier on the last slide, you saw that some of the courses are only 1 credit hour. The 1 credit hour courses meet roughly 5 times per semester. So if you think with the hybrid format, that'll roughly mean, say, 2 to 3 class meetings and then 2 to 3 sessions that are delivered online. again, students told us that they want the convenience and flexibility of online that's delivered well using video lectures and so forth. But at the same time, healthcare is such a collaborative type of endeavor that it was felt that the face-to-face is very valuable. Our students want to build relationships with one another. They want to see each other. They want to share experiences and so forth together. So that was the motivation for the hybrid format. When we do meet face-to-face, the meetings are going to take place in the evenings and on weekends. Evenings for us in New Brunswick means 6:40 to 9:40 p.m. Weekends will typically be the courses that are more likely to be taught by practitioners, like the healthcare law course, right? But it wouldn't make any sense for me to hire a PhD qualified professor to teach that course, right? We really need a healthcare attorney, someone who's in the trenches and know what's changed with Stark Law and anti-kickback in the last 6 months and can report out on that. Those types of courses will probably, it's not guaranteed, but those will probably be delivered during the weekends, maybe on Saturdays, that type of thing. The face-to-face courses will be delivered in New Brunswick and Piscataway at our 100 Rockefeller Road brand new state-of-the-art facility. Really cool place. If you haven't been there, let me know if you'd like a tour. We'd be happy to arrange that. Okay, so that's a little bit about our program and what makes it unique. In terms of next steps, if you'd like, we have a soft deadline of July the 1st for applications, but again, be very frank in that I'm confident we'll accept applications after July the 1st, but certainly from a planning perspective, it helps us in terms of scheduling courses and whatnot to get the apps in as quickly as possible. In terms of the application, it's available online at our website, and we just require then 2 letters of recommendation. There's an essay because, frankly, we're very interested in your motivation for the program and what you bring to the program, what you bring to the experience of other students. Transcripts from all your undergraduate as well as any graduate work. We do also consider a GMAT or GRE standardized test, but I'll just tell you now that it is possible to have a GMAT or GRE waiver. I look at 2 factors for that. One would be your academic preparation. So what have you done academically in the past that would warrant a GMAT or GRE waiver? And then secondly, the work experience that you bring to the course. And then also the third way to look at that would be, a combination thereof, right? So for individuals who are, say, have strong engineering backgrounds, strong quantitative backgrounds, maybe a science background, a GRE or GMAT may not be necessary, right? But the primary aim for me to, evaluate the GMAT or GRE is to get a sense that the student can make it through, the quantitative courses in the program. We want to position you for success. The program is not a quantitative program per se, but there are a couple of courses like healthcare operations analysis, like data analytics, that are a bit quantitative in nature, and we want to make certain that you're positioned for success there. At the same time, if you have a very strong industry background, a strong track record of success that indicates a high level of motivation, that's another pathway to potentially gain a GMAT or GRE waiver. Basically what you do is you complete your application, you submit all of your materials, and if you'd like to be considered for a GMAT GRE waiver, you would make that request to me or through the application process. We'll schedule a Skype or a face-to-face interview and then make that decision. We'd also like, of course, a resume to gain a sense for your work experience and so forth. And then for international students, the TOEFL is also required. The next few slides are really just some testimonials. I'd invite any questions at this time as well. If you'd like to include a question in the chat, I'd be delighted to to address those. This first testimonial is just from a MD MBA student who I taught a healthcare services management course here right now in the master's program, in the MBA program as an elective. Alex is a very bright individual, of course, doing very, very well in med school now down at RWJ, and had some very positive comments to make about the course, which is really indicative of the program, right? It says that it helps me understand the manager's constraints that a manager faces in the healthcare field and to develop tangible skills necessary to navigate that landscape. I gained policy-level insights. So this is really speaking to the reimbursement issues that we've talked about, that we flush out, and then, of course, understand how to operate at the department level in the context of those policy issues. Of course, then we have some practitioner feedback from the marketplace. This was Dr. Mark Klappholz, who's a professor and chair of the Department of Medicine here at the Rutgers, New Jersey Medical School. He likes to talk about the fact that healthcare is changing quickly to become more business-oriented and emphasizing the importance of business skills. Here he says that healthcare providers and administrators need to develop expertise in analytics that identify and track population health outcomes, and in strategic realignment with integration of providers to facilitate the transition to this new model of care. For these reasons, the Healthcare Master's Program at Rutgers Business School provides a unique opportunity to be at the cutting edge of a changing paradigm in healthcare. And then finally, from RWJ Barnabas, the CEO Cerny Neves tells us that the healthcare industry is changing rapidly, and in order to be successful, healthcare leaders need to engage in unprecedented pace of change, right? They need to be very engaged. Rutgers University is committed to improving healthcare delivery in New Jersey and beyond by offering coursework that prepares students to effectively lead in these changes. These types of individuals are the types of folks that we call on, frankly, as guest speakers. So CEO serves as the Vice President of Physician and Patient Services at St. Barnabas. She's been a wonderful speaker in my MBA classes. We do this, of course, again, to ensure the relevance of the program. Okay, so that's what I have in terms of content for today. I can't tell you how much I appreciate your time and attention. I hope that you found the session useful. My email address is on this slide here. Unfortunately, my last name is 12 letters long, so I apologize for that, but there's not too much I can do about it. My email address is ddobrzyki@business.rutgers.edu. I'd be delighted to field any questions that you have or direct you to the completion of an application. I'll make one final call for questions. Looks like we may have someone typing. Are we able to combine this degree for a joint MBA dual degree type thing? What you can do is, again, on a case-by-case basis, some of these courses are provided as electives in our 60-credit-hour MBA program. So the benefit of that, of course, is that you get the MBA and you enjoy the benefit of this, broad generalist type of degree program. It's an excellent program. However, what the disadvantage is that you don't have the deep dive of 30 credit hours or 36 credit hours into the healthcare context. So you would just be using the concentration. Dr. Mahmoud Hassan, who's the director of our pharmaceutical MBA program, serves to help students, select courses for the healthcare, basically what is a specialty concentration in the MBA, and I'm also happy to help you with that if that's a direction you'd like to head as well. Again, they're just different products, and I think it's just an individual decision. Both are excellent products. It just depends on your goals. Okay, so there's another question. This may have already been addressed, but is there a part-time student option? Absolutely. Thank you for that question. This is a self-paced type of program, so I'm going to flip back a few slides to the listing of courses. We have students that would like to finish as rapidly as 1 year. For example, there are some folks that may be in between opportunities, or even medical students who would like to step out of medical school for a year. They're welcome, to attempt to complete this in a year. It's, of course, aggressive, and we have to have a volume of students, necessary to provide the courses to enable that. But you also have up to 7 years, if you'd like, to complete the program. So to be very honest, the typical profile of student that I'm speaking with are individuals that want to take 1 or 2 courses per semester and finish somewhere between 3.5 years, something like that. Great question. Thank you for that. But again, to be clear, you have at least 7 years if necessary to complete the program. Other questions? Okay, well, it doesn't look like we have any other questions. I just, again, want to thank you for your time and attention. I'd welcome any emails from you in terms of questions about the program or even feedback on this webinar. We're doing our very best to make this as useful and valuable for folks as possible. So if you have feedback in terms of how we can make that happen, I'd be delighted to do so. And I guess I would be remiss if I didn't close with a "Go RU." Have a great day, and thanks for your attention.